Okay, so good afternoon, everyone, and welcome to the fifth webinar organized by the European Hospital and Healthcare Federation in collaboration with PACS, entitled Quality and Safety Network. We will begin shortly, so there's supposed to be a little bit more participants. So we'll wait another 1 or 2 minutes just to allow the last participant to join in, and then we will begin. Okay, so I suggest we begin. Probably a few participants will join during the webinar, but so that to avoid any delay, we shall begin. So again, good afternoon, everybody, and welcome to this webinar. So this webinar is about regional strategy for patient safety improvement. And so we'll spend the next hour together, and I will try to make things clearer possible on how at PACS we developed this regional strategy for patient safety improvement, and which are the first results and the first recommendation that we sent to the authorities. So my name is Dennis. I'm the CEO of PACS. I have PhD in economics and management, and also a certificate in quality management in healthcare organization. As I said, so I'm CEO of PACS, and I will briefly explain to you what PACS is. And I'm also the head of research and quality at Santea, which is one of the largest hospital association in the French-speaking part of Belgium. And I'm also a professor of health economics at the Université Libre de Bruxelles, so that you know a little bit of my curriculum briefly. And so this is the plan for today's presentation. So as I said, I will really briefly explain you what PACS is about and what we are doing at PACS. Then I will also briefly explain to you not how Belgium is working from an institutional point of view, briefly, because it will take too much time to go in all the details, but briefly how healthcare is dealt with here in Belgium and what kind of quality and safety policies we have. And then the core of the subject is how we develop this regional strategy and what are the main actions that we recommend. And finally, some thought on the next steps that we want to take to implement this strategy. Just a word also to say that I'm alone today to both doing the presentation and managing the question that may be asked during the presentation. So obviously you can use the chat box to ask some question. Unfortunately, my colleague Laure, who's usually deal with this webinar, is on maternity leave. Everything is fine, and she will be back by beginning of November. But I have to deal everything with myself today. So we'll briefly pause between each part of the presentation, so that I get the possibility to answer the question that you may have. So PACS is the organization that I'm leading. PACS stands for Platform for Continuous Improvement of Quality of Care and Patient Safety. It's quite a long name, that's why we use only PACS. So basically, PACS is really about helping healthcare institutions to develop and implement quality improvement projects. We are working in Belgium, but not in all Belgium, only in Brussels and Wallonia, which is basically 2 on the 3 regions. We start as a really small organization. So we started in 2014 with less than 1 person. Actually, we were 2 part-time people with a already small budget. And so we grew up through time. Now we are about 8 people. Actually, it's 9 people and 8 full-time equivalent, and a bigger budget to organize different activities that I will briefly then explain to you. We were created in 2014 in a context of hospital accreditation. In that period, hospitals from Wallonia and Brussels were wondering a lot about what is accreditation, what is the value of accreditation, what are the costs, does it worth it, etc. So we basically were created to first answer all this question, so to inform healthcare institutions, and also to raise awareness on this kind of issues, and to help them making the first step towards accreditation. And so through time, we really evolved from being focused only on the tool to really try to focus more on the topic that this tool accreditation tends to address, that is patient safety. And we are moving towards the highly reliable organization. That is how we can move to a no-harm paradigm into the healthcare sector here in Belgium. And this is explaining why we've been working for 2 years now on this regional strategy to improve patient safety. These are a few examples on some topics that we are working on. This is probably quite familiar to all of you, so I'm not going to spend time on this, but these kind of topics that we are working on. Our activities are basically based on 3 main pillars. The programs are our core activities, and it's freely available for all healthcare institutions from Wallonia and Brussels. And so these programs are basically based on some pilots project and collaboratives, with really the objective of working together, exchange best practice, and to see how we can, basically improve quality by sharing best practice. The pilot project, we organize some pilot project around some specific tools, such as the team steps methodology that has been developed by the AHRQ in the United States with the Department of Defense. And so this toolbox is meant to improve teamwork. And this toolbox has been translated to French by a Switzerland team with whom we are working with. And so we use this translated resource to implement this program, and this program has a lot of success. Another example on this pilot project is a project that we launched around patient-reported experience measures, for example. So this is the kind of project that we are doing into these programs pillar. The second pillar is the training. To be part of this training, healthcare institutions have to pay. So conversely to the first pillar, and this is mainly in-person training, although we are moving slowly also to developing more e-learning training, especially since the COVID-19 crisis. And so we are really trying to develop this. So in terms of e-learning, we also translate the Open School from the IHI in French, and is available on our extranet. And finally, the last pillar is the resource. And so we are really trying to gather useful resources and tools, and to make them available for all healthcare institutions and professionals here in Belgium. Finally, for this small presentation of PACS, we try to develop a lot of partnership in Belgium, in Europe, but also throughout the world. The idea beyond that is that obviously Belgium is small, and so 2 regions, Wallonia and Brussels, is smaller. So the most efficient way to be able to organize activities and provide our healthcare institution with useful resources, basically to have partnership around the globe and with other countries and other organizations, and to be able to work as I said, from an efficient point of view. So we have two big partnerships with HSO, which stands for Health Standards Organization. There's a Canadian organization, and the Institute for Healthcare Improvement. I assume that you are all familiar with it. And obviously, you can see on the slide, obviously, we're working with them. So just before to move to the second part, so there's a question about what time of accreditation training is it for a clinician, how many days, and is this a refresher course as well? So it's not really a refresher course, mostly because here in Belgium, there is almost no content in terms of quality and safety in the basic training. So it's not really a refresher. It's really more to give healthcare professional the basic of quality and safety improvement. So we basically have a 3-day training, in-person training on the basic of improvement. So what is the measures? Or can you look for useful resources? Or can you implement the first improvement project, etc.? And next to that, we are developing some specific course on some specific competencies that are assessed to be useful to implement some quality project. And so these competencies and courses are around leadership, teamwork, patient involvement, etc. Okay, so I will look then the link that you sent me. Thank you. Okay, so let's move forward to the second part, which is quality and safety in Belgium. So Belgium is a small country, as you probably all know. So it's a constitutional monarchy. It's a federal parliamentary democracy. So really the important point here in Belgium for this presentation is that we have two levels of power. So we have the federal level, which basically is Belgium, and then federated level, which are on two kind of. So we have the communities, so 3 communities in Belgium, which are based on the language that you speak, and 3 regions that are based on the where you live, basically. And the key point here is really to understand that there is no primacy between the federal and one or another federated level. So some competencies are at the federal level, other competencies are at the federated level, and we have to deal with the fact that there's no level is the boss of another level. And so it may be complicated, and as this picture show you, healthcare in Belgium is quite complicated. And obviously this arise more strongly during this COVID-19 crisis. So I won't give you a full institutional course, as I said, if you're in Belgium, because it would take way too long. But this is just a few key features from the Belgian healthcare system with a few principles that you probably have in most country, or in many countries at least, which are the features of solidarity, accessibility, reasonable cost, and freedom to choose the healthcare provider. So you really are free to choose whoever you want. Most of the population is covered by the healthcare system. You have to be a member in the healthcare insurance fund, which covers most of the cost of healthcare. However, citizens have to pay what is supposed to be a minimum contribution when they're asking for service. However, this contribution may be quite important depending on the pathology you have and the kind of service you requested. Okay, and so regarding hospitals, we do not have private for-profit hospitals. We only have private non-profit and public hospitals. And there's supposed to be no selection of risks, at least officially. And as I said, healthcare competencies are really split between the different levels. You have a few examples. It's only a few examples on the slide, but this gives you an idea on how healthcare competencies are really split between the level. Just to give you one example, if you look at hospitals, for example, so hospitals are mostly financed by the federal level, unless some specific things. But it is a federated entity, so the regional authorities and communities that are responsible to define and apply norms and regulation for hospitals. And that obviously can be quite annoying because so you cannot put a new norm and a new standards for hospitals without having a cost for the federal level. So it's kind of complicated, this kind of split of competencies. There's starting to be a lot of discussion about moving toward more regionally, more competencies going to the federated entities, but it's at this point at least still on discussion. So very complex institutional framework, a lot of competencies split between the different kind of level. Quite a good system, hopefully. So what about quality and safety policies in Belgium? So at the federal level, we have a lot of things actually. It started around the mid 60s when was written the first Hospitals Act, in which the authorities wrote down the first norms for hospitals with the assumption that if hospitals meet the norm, then we have quality of care. So in the mid 60s, these norms were mainly structural. So in terms of size of the room, water in the room, and stuff like that. So through time, they add some more qualitative and process-oriented norms. But yeah, nothing about outcomes. Still at the federal level, we also have internal and external evaluation of medical activities as well as nursing activities. So that's a federal competencies. We also have the policy on infections prevention, on medication, on transfusion, medical imagery. We also, by the end of 80s, beginning of 90s, developed some care pathways for certain specific pathology. And recently we had some focus on the healthcare practice, and also they are trying to develop some kind of hospital audit in terms of activities, but that's still a proof of concept, or at least not fully implemented. So there is a lot of stuff actually, but one thing is crucially, well, we have a lack of one thing is really to approach these patient safety issues from a system-wide point of view. And so with really a big plan that would put together all these aspects. There's one exception on that. There's been patient safety plans from 2007 to 2017. So that was really the first attempt to address this issue of patient safety through a single plan that would cover all aspects of it. It led to some results, but unfortunately it was stopped in 2017 and replaced by a pay for performance, pay for quality scheme at the federal level. This is not the point today, but maybe we can, at some point in the future organize a webinar on this issue of patient pay for performance. I don't really like that, but anyway, we could discuss that later. At the regional level, so there's been a big reform in Flanders in 2009. So So at that time, the newly elected health minister, we have a lot of health minister in Belgium, 9 actually, due to the different level of authorities and competencies. But anyway, at that time, the newly elected minister in Flanders launched an inspection reform, as well as publication of inspection reports. So the idea was really to go for more transparency from healthcare, and it's still on the agenda today. It's really to make things transparent and making available for citizens the quality level. So there's still the question on how to measure it and to be sure that the measure is accurate. But anyway, that wasn't still the idea. And also the development of quality indicators. That's also with the same objective of making this quality level available for the citizen, and also encouraging hospitals accreditation. So that was a big plan and a big reform, and so it led to a lot of success actually. And the hospitals in Flanders really improve at least the system-wide approach for quality, and that's really a good thing. So that kind of broad approach is still lacking in Brussels and Wallonia. So there's been some action taken. In Brussels, they wrote the Brussels Health Plan with also there the idea of improving quality. And in Wallonia, there's been also to be action on for quality hospitals and healthcare in 2013, as well as to making the accreditation process and the fact of having indicators and working with quality indicators. So having these two aspects as a condition to necessary condition to obtain some financing for the infrastructure. So there's been really some stuff put on the table, but again, no broad plan to improve patient safety. And so that's really from that fact that we decided, like 3 years ago now, to launch some reflection and to launch some work to develop a regional strategy at PAX, which we call Livre Mauve, which is a purple book. As you can see, purple is kind of the color of PAX, and that's why we call it that way. But this is really developing a regional strategy. So this is the core. So how did we develop this strategy? So the starting point was the paper or the report from the OECD from March 2017 called The Economics of Patient Safety. And so for those of you who don't know this report, this basically a report built on 2 parts. The first part is a literature review, and that is pointing to assessing the number and the rate of adverse event and the consequences of this adverse event in an hospital setting. They did other reports for the other line of care. And the second part of this report is a survey that they sent to experts on patient safety. And they asked these experts to evaluate, to assess some safety intervention, 42 actually. And so they asked for each of these interventions, and there's a list on the next slide. So they asked these experts to evaluate the cost and benefit ratio from each of these interventions. And also they asked if you would have to build a bundle of intervention of maximum 7 intervention to act on patient safety, what would be the selected intervention? So that was really the 2 questions. So that was the starting point of our work to develop this patient safety strategy. And so we first decided to replicate this survey. We did by the end of 2017 and launched this survey and sent this survey to exactly the same, with the same intervention and the same questions. And we send this survey to 13, well, a little bit more, but we get answer from 13 healthcare provider association, as well as 2 experts in patient safety. And so we gather the results. somewhere at the end of first trimester of 2018. And then we organized a few workshops with this healthcare provider association to discuss the results and to see what kind of priority areas we could identify from these results. So for those of you who didn't read the report from the OECD, and I advise you to read it because it's really interesting. So the intervention that was submitted to these experts, both in the OECD report and in our survey, was intervention that can be classified into three main level. The system level intervention, so it's really at macro level, the organizational and institutional level intervention, so it's more meso, and then you can find stuff like person and patient engagement initiative, incident reporting and management system, safety culture and hygiene initiative, so this kind of stuff. And finally, the third level was the clinical level intervention, so it's really micro at the bedside if you want, and mostly around some protocols from some issues. So that was a 42 intervention that was submitted to the expert. And so that's the result that we get. So in terms of cost-benefit ratio, what we found is that the best intervention was really the clinical level interventions. So basically, when you take each intervention independently of the others, what the expert in Belgium and the professional association in Belgium thought was that the best ratio cost benefit was for the intervention at the bedside and more on the protocols around some issues. But from a bundle point of view, and so if they had to select up to 7 interventions to make a bundle and to act on patient safety, then they mostly select intervention at the meso, so institutional, and the macro, so at the system level. So that's really interesting for 2 reasons. First, because it shows that it's obviously the bedside protocols that is the best cost-benefit ratio, but if you want to act significantly on patient safety, you have to work with a bundle of intervention as well at the meso and macro level. And the second reason why it is really interesting as a result is that actually it's exactly the same results as the OECD gets. So there obviously some kind of bias in terms of answer beyond that. So it's not a completely unbiased statistical survey, but however, we really think that shows some really interesting result on which we can work on. So that was the main results, and so we discussed, as I said, with these experts here in Belgium and professional association around these results and then the selected intervention. And so we end up with 5 priorities to work on, which are the training of professionals. The second one was the management of adverse events. Then the measures and indicators, safety standards, and finally involvement of patients and families. So that was really the main areas that the healthcare sector, because that's what it is, so expert and healthcare professional associations really point out as the priorities we have to work on to improve patient safety. So that was mostly theoretical, and so we engaged in the second step, which was composed by all these points. So at PAX, what we did is we did a literature review on each of these priorities. And so look into literature and evidence and best practice, what we could find out, and how we can document each of these priorities area, and what kind of recommendation could be made on these various priorities. At the same time, we launched a second survey, which was addressed not to the professional associations, but to professionals themselves. We try to reach a maximum number of persons, and we launched this second survey by the end of 2018, so 1 year after the first one, and we got a little bit more than 700 responses, which is at the same time good and not so good. Good because usually we don't get this number of answer when we launch different kind of survey, so that's a good news. The not so good news is that we have obviously thousands and thousands of healthcare professionals in Belgium, so we cannot say that this is representative of all the sector, but anyway, that gave us some matter to work on. And so in this second survey, we basically asked two things to the respondent. The first was regarding each priorities from your point of view, what is the current situation? And the second question was again for each priorities, and depending on your assessment of the current situation, how do you think we can improve it? So basically, it was really to get this point of view from the front line. So without any scientific background behind it, it was really just to say, in your mind, in your experience, from your point of view, what is the situation, and if it is needed, how could we improve it? And so we closed this survey again by the end of the first trimester of 2019, and again organize a few workshops to discuss the results. And also obviously to discuss the work that we've done at PACS in terms of literature review and recommendation based on the priorities. And so we had quite interesting discussion about it. And after a few meetings, we came up with not priorities, but strategic actions, so more concrete action to take to improve patient safety. And that was done by the end of June 2019. And we choose not to release already the strategy, because we organized last year in October 2019 a big international congress. And so we have a quite famous international expert on patient safety that was coming for the congress. And so we choose to not to release the report during the summer, but to wait the congress. So we have the opportunity. So we have the opportunity to present our results to this international expert, get their feedback, and to see how we can improve the strategy and what we wanted to be implemented in terms of action. So we get really incredible, interesting feedback from these experts. So we had experts from Denmark, from the Patient Safety Institute, from the NHS also, from Teja Gandhi, who was the former Chief Patient Safety Officer at the IHI, etc. So also from Canada. So we had really famous and well-known experts, and who give us really interesting feedback. So we got everything finalized, the strategy by the end of 2020. So our plan was to meet with the authorities by the beginning of 2020, to present them this strategy. And so the first meeting was planned during March 2020, but as you all know, obviously COVID-19 arise, and so everything was put on hold until the end of at least the first part of the crisis, and which led us to delay the release of the strategy. And so we finally released it 2 weeks ago for the World Patient Safety Day. So it's a few months later, but that's life. So that's basically how we build it. And so I will spend the next 10 to 15 minutes just to give you some element that we put on it and how we structure the strategy. So we structured the strategy into 5 package of action, and you have the name of this action bundles, if you want, on this slide. So we start with the monitoring and managing patient safety, promoting patient safety, building a patient safety culture, regulating patient safety, and obviously improving patient safety. So that's the 5 bundle of action that we develop and that we recommend to authorities to implement. So regarding the first one, monitoring and managing patient safety, we are obviously lacking of accurate data on the patient safety here in Belgium. So we have a few data, mainly on some issues such as blood transfusion, some aspect of medication, and also some aspect of hygiene and infection prevention. But we, for example, do not have any indication, or at least reliable indication, on what is status in terms of adverse event, and the number of it, and what kind of adverse event are the most present here in Belgium. And so really in this action package, the first action to undertake, and that we want authorities to help us to put in place, is really to have a more reliable assessment of the current situation in terms of patient safety in Belgium, and also to use this assessment to monitor the situation along the way of implementing improvement action. So on that point, we'll most probably launch a study beginning of next year to see to what extent we could have a reliable assessment of the situation based on patient safety indicators, which we will try to compute based on ICD-10 data that we get. We actually tried to do it, not us, but a few years ago, one university in Belgium tried to do it on ICD-9, but it was basically not really reliable. So we'll try on ICD-10, because apparently in Canada they do it and it seems to be more accurate. But that's something that we'll do. So the first point is really to assess the situation and then identify priorities, which is our second point. And we say we need data, then identify priorities, and once these priorities has been identified, then we can develop action plan, including action itself, to do action package, if you want, to be implemented on the front line, but also to have indicator at all level, from micro to the macro level, so that we can monitor the situation, make sure that the action that has been undertaken are working, and obviously also document the progress made. The idea is really to work on the possibility of scaling up a success story. But to do all that, the first point is really to have a more accurate idea of the current situation and to have some measurement tool that can be used to monitor the situation along the way. So that's really the first action package, bundle action that we recommend. The second bundle is about promoting patient safety. So it's really they're raising, and there's a typo there, I'll correct it. But it's really about raising awareness on patient safety issues. As I said to one question that has been asked at the beginning of the presentation, here in Belgium, at least for the physician, but it's also true for many other healthcare professionals, there's almost nothing said in the basic training about quality and safety. And literature is quite clear on this subject. We need to put that in basic training, and obviously lifelong, but I'll come back to that point later. But obviously we need to put some elements on quality and safety issues in the basic training of healthcare professionals. So that's really one of the strongest recommendations here in Belgium. It's really about modifying the basic training of healthcare professional to put some quality and safety topics into this training. This will be kind of challenging in Belgium because of the different authorities level and the split of the competencies, but this is something we have to work on. We also raise awareness with the public. And so with the idea of launching some information campaigns, really to work with the public, to work with the patients, work with the family, so that they can be an actor of their own safety and they can work with us to improve patient safety. And also there is a need for political actors and for authorities to develop and to make a transparent, a strong vision on patient safety. This is something that we do not have currently, at least in Brussels and Wallonia, and so we are really asking the authorities to develop their own vision, a strong vision, and to make sure that this vision is known and heard by the healthcare professional, the healthcare sector, but also the public. The third building blocks is the building a patient safety culture. As you all know, it's really probably one of the most important aspects to work on also. There are a lot of important aspects to work on. And so what came out of the literature review and the two survey is two main points. The first is we need, as in the previous building block, to also put quality and safety aspect into the lifelong learning of healthcare professionals, and that's a way to develop and to stronger patient safety culture. And we have to also work on management of adverse events. So the patient safety plans that was running here in Belgium between 2007 and 2017, and I'll talk to you about that a few slides ago, really help to make sure that all hospitals have indeed a management system for adverse events. So that's a good thing. But when you're talking to frontline workers and to also quality managers, you realize that even if this system is indeed present now in all hospitals, it's still not ideally working, and so there are some reporting, but obviously not enough, and so there are some kind of learning that has been done on this basis, but not enough either, and so there's still work to be done on building a strong and just patient safety culture with, for example, this aspect of management of adverse event. And obviously, as you probably all know also, we really want you to spend time in involving more patients and family in quality and safety in general, but specifically also in reporting and analysis adverse events. Interesting point maybe maybe one point that may be of interest for you regarding this element is that we at PACS are part of a pilot project from the OECD into launching a patient-reported incident measures project. It was supposed to be launched this year, but again, due to COVID-19, it has been postponed to the end of this year. But it's a project to assess a patient-reported incident measure tool that has been developed at the OECD, and to see to what extent it is accurate and useful here in Belgium. And similar project has been done. Is currently running and will be running into the all OECD countries. The fourth building block is about regulating patient safety, so there is 3 main points in this building block. The first one is making mandatory the reporting of serious sentinel adverse events. So this is something that was not intended at the beginning of the work, but that's really something that came out discussion we have with several experts from different countries, from France, but also from Denmark, for example. Denmark, which has a really strong regulation on protecting the people that made this kind of reporting and the analysis that came out this reporting. And so this is really something that we want to work on. It's really to see to what extent we could make this kind of reporting mandatory. Not because we believe that making that mandatory will make that we have perfect data. We are pretty convinced that it will not be the case, but we strongly believe that making this kind of reporting mandatory could help us develop the culture, develop the awareness of these patient safety issues for the high management of healthcare institution, etc. And so this could be a leverage that helps us to move towards a more reliable system. But to be able to do that, we have some more technical and legal aspect to work on, and so this is something that we just launched in terms of legal aspect. For example, we just launched some work last week to develop really some regulation that could protect to a certain extent the people that report some serious and sentinel adverse events. The second main point is the imposing of compliance with respect to safety standards in the regulation. So again, also that's something that really surprised us when this came out of the discussion into the workshop with experts, but also with physician and nurse and other healthcare professional. This is something that for a long time, well, since the beginning of PACS, we were really more on the idea of not putting this kind of safety standard in the regulation, but people from the front line told us that this also could be a way and a leverage to work on patient safety. And so after many discussions with many experts and after quite an exhaustive literature review, we decided also to recommend to put some safety standards mandatory in the regulation. However, the idea here is not to start with that. The idea is really to start with identifying priorities, put action plan, having measures and indicators, identifying best practice, and working on the scaling up. And only at that point, when we identify what kind of practice can really add to address some priorities, then only at this point put that into the regulations. So the idea is really not to put imposing something from top down, but it's really more about identifying priorities, building action plan that actually work on the front line, and then only put that in the regulation to ensure that progress can be sustained in the future. And so the idea is really more building bottom up than top down. And finally, also public reporting. This is something that is that really work on in many countries, and in Flanders, so in one of the regions in Belgium. And so this is also something that we want to work on. And finally, the fifth building block is a building block about improving patient safety. And again, this relies on, so the second and the third point is really to be linked with the identifying priorities, develop action plan, putting this action plan into action, and having a comprehensive system of measurement from the ward to the system to make sure that we indeed improve patient safety. And one additional point is developing a patient safety officer training, so to make sure that in each healthcare institution we have experts in terms of patient safety that have the right and the most useful tools that allow this institution to really improve patient safety and quality of healthcare in general. This is a training that we started to develop last year, and we will at the end of last year, and we will start to deliver it probably beginning of next year. So this is the 5 building blocks with some of the point that has already been put into motion. But some of the points that really require the support, and more than support, really concrete action from the authorities and different governments. So the next steps for us at this point is really to present this strategy to the authorities and to discuss with them the action that they need to take to move towards a more reliable system. So the action, relying on the previous slide, is basically about vision and raising awareness, about education, not really developing the content, because we can obviously work with on that, and also with university, but really to have the political leverage to modify the curricula from the basic and the lifelong training for healthcare professional, management and monitoring of the patient safety issues and the regulations. So that's all action that need to be taken, or at least supported by the authorities. So we already presented the strategy and the different action point that they need to take to undertake to Wallonia. So both the administration and the staff of the minister, and we hope to be able to do the same for Brussels within the next few months. So we can hopefully really start working with authorities beginning of 2021. Hopefully COVID-19 will be not history, but more manageable. And so at PAX level, we already start to work on what we can. And as I said, we work on developing a patient safety officer that will be that we will start to deliver beginning of next year. In terms of research, as I said, we will launch a study beginning of next year also to try to see to what extent we can assess the patient safety issues and adverse events based on the data that are collected, coded in ICD-10 and collected on a regular basis, daily basis from the hospitals. So that's a research that we will launch next year. We also launched last week some legal work on the mandatory reporting adverse events, and we hope to finish the preparation work by beginning of next year, and then try to see to what extent we can put that into the law. And finally, regarding patient safety action plans, we obviously already work on some priorities and action and measured indicator and transparency. However, as I said, we're crucially lacking some data in terms of patient safety in Belgium. So for the moment, we identified the priorities on which we are working at PAX based on what has been done and what is been doing in other countries and other system, and we will continue to do so with the assumption that we shall not be that different from other OECD countries in terms of priorities to be working on. But however, the plan is really to be able at one point in time, and hopefully not too far from now, to have data from Belgium, and so to be able really to identify what are the most important priorities we have to work on here in Belgium, and from that point also to monitor to what extent our action and different action that will be undertaken really improve the situation or not, and so to identify the best action in terms of patient safety improvement. So that was about it, about this strategy, how we develop, and what kind of action we recommend, and where we stand now, and what are the next steps, both at PAX level, but also from for the government and authorities. So we are right on time because we have it's 4, so we are really fine from that point of view. One last thing that we have to say to you is that the next webinar will be also about safety program, and so there will be a presentation from 2 people from the Netherlands that will present you and to the person that are interested, the national safety program in the Netherlands. The date still has to be confirmed. Open PAX will probably have a meeting with them sometimes within next 2 weeks, and so hopefully we'll be able to send the save the date for this next webinar by the end of October. I assume that we will organize this webinar sometime in December or beginning of January, but anyway, this will be confirmed probably, most probably by the end of October. So that's about it. I hope this presentation was understandable. I'm not, my English is not perfect, but I hope I make myself clear. I hope also well, this webinar was interesting to you and give you some interesting point. Obviously, so you have the global address of PAX, which is contact@pax.be, as well as the website. So if you have any question, of any comment, of any recommendation or additional element that you think it could be interesting to add to the strategy, please feel free to send it. It will be really appreciated. Any feedback, any comment. And so for the rest, last thing, so this webinar will be available online on the YouTube channel of PAX. Information will be sent to the person that attend this webinar through the PAX different communication channel, as well to Hope communication channel. And so for the rest, since there is no question, at least I'm not seeing any question, I wish you a very nice end of the afternoon, and well, I hope we'll see you really soon. Thank you. Bye-bye.